Welcome everyone to this webinar on estimating carbon emissions for delivering immunizations program globally. This session is co-hosted by UNICEF and TechNet21. Before we start, please note that this webinar is being recorded and the link to the video as well as the presentation will be shared by email to everyone who registered after the webinar. During this session, feel free to ask your questions to our panelists by typing them in the Q&A box at the bottom of your screen. Questions will be answered during the Q&A session after the presentation. Please note that this webinar will be conducted in English only. Pour ceux d'entre vous qui avaient l'intention d'écouter ce webinaire en français, nous sommes au regret de vous informer que l'interprétation française n'est malheureusement pas disponible. I am now going to give the floor to Michelle Seidel from UNICEF, who will start this presentation. Michelle, over to you.
Good day, colleagues, and today is World Environmental Day, so we thought how apt it would be to disseminate our findings on calculating the carbon footprints of the immunization program. But before we get into that, I thought maybe we would introduce the panelists as well. So I'm Michelle Seidel, and I'm the team lead for immunization supply chain at UNICEF headquarters, outposted in Copenhagen. And with me is my colleagues Ranjit and Nitant, and I'd like them to introduce themselves as well before we jump in. So Ranjit, over to you.
Thanks a lot, Michelle. So I'm Ranjit. I'm, as Michelle said, part of the immunization supply chain team led by Michelle. And my portfolio is on, I'm managing the portfolio of primary healthcare infrastructure, which includes solarization of health facilities, waste management, and climate lens, basically to deliver immunization services. Over to Nitant.
Thanks, Ranjit. Hello, everyone. I'm Nitant Mate. I'm the subject matter expert here. I've been working in the field of sustainability for the last 35 years altogether. And I've worked extensively in renewable energy as well as sustainability. I'm basically a mechanical engineer. Thank you.
Thank you very much, team. Okay, so over to our next slide, and to give you a bit of a background in terms of why we did this. So Nitant, if we can move to the next slide. So we thought it would be important in terms of understanding, first of all, what the global carbon emissions look like. So from fossil fuels and industry, we're looking at 37, just over 37 billion metric tons of carbon emissions. And as UNICEF, we felt that it was, and we do feel that it is important to reduce our carbon footprint and our greenhouse gas emissions, particularly as we implement our interventions in countries that are particularly vulnerable to climate change, and we need to have climate adaptive programming as well. So estimating our baseline emissions is something that we had a look at, and we'll hear later on in terms of the recommendations and the outcomes as well, and how we are feeding that into our programming as well. The climate action and sustainable procurement is also a major part of our strategic plan for UNICEF. And the team here has produced this first draft, and obviously we will be producing subsequent iterations of this as well. So now I'll hand over to Ranjit to speak a little bit about the methodology and go into the meat of the matter. Over to you, Ranjit.
Thank you, Michelle. So as we said, this is an exercise we embarked into. It's a global exercise to say that what are our emissions to deliver immunization program globally. So to do this, we considered 194 countries which are delivering immunization services either through government plans or donor supported. And then we also looked at 13 common vaccines that are immunization profile. We looked at the emissions from from the suppliers, which means production of vaccine, production of cold chain, and the production of ancillary supplies like syringes and temperature monitoring devices. So we looked at all the aspects. We also looked at the transportation emissions, what it takes to transport the vaccine from the manufacturer to the port of entry in the country, and within country transportation to last mile, which could be remotest part of the country and all the countries in the world. So it's a massive effort. We also looked at operational aspect, what it takes to operate the cold chain, because cold chain is needed to store the vaccine till the vaccination is done. So what it takes to, what are the emissions by electricity use, what are the emissions of diesel generator use, and then we also looked at waste disposal, which is very important integral part of the immunization supply chain. How do we dispose syringes, and what it takes to dispose the syringes with the current practices today. Also cold chain equipment, decommissioning of cold chain equipment once it's reached its lifetime. So sources of information is something which is always a point of challenge. We have limitations of information. So with those limitations, we did the first cut exercise, and Michelle said there will be more and more iterations as we go. We'll be refining the information with let's say wherever we use the assumptions, we replace that with actuals as we go. For now, we use the information coming from some manufacturers. Wherever possible, we use the WHO data for referring to coverage, population, wastage rates, and cold chain assumptions. We use World Bank data for electricity status and see that the sources of electricity production is different for different countries. The emissions for producing the for producing the electricity is different for different countries, and also the quality of electricity that determines the need of using the generators as a power backup. So that we use World Bank data. We also use assumption from serious credible sources for all different components. And then we did produce a massive tool which is customizable, and we will be that's our plan, that from here onwards we'll be opening up with countries to look at their own contribution to the emissions and fine tune from there, and also start populating in the actions to mitigate this. We also did the analysis scope 1, 2, and 3, which Nitant will explain later on categorization of emission. Next slide, please. So key data sources, we just mentioned, we use WHO and unique data, WHO, UNICEF estimates for national immunization coverages information, WHO PQS, which is performance, quality, and safety standards for cold chain, which defines the electricity use, which defines the weight, which defines the several parameters that are needed for emissions calculation. So we'll not go into depth. You will get the presentations where you can see the references. We'll jump straight to the results from here. So we saw that in the background, what is the global emissions? What are the global emissions today on this planet? And delivering immunization services globally every year is 0.00094% of the global emissions, which is 350,000 carbon emission tons equivalent of a CO2. So with this number, we need to put that in perspective. What does it look like? So the perspective is it's equivalent to 226,423 passengers flying from Dubai to New York. That's the kind of emissions emitted when you fly from when you fly between these two destinations. So about 226,000 passenger flying is the equivalent emissions we are producing every year to deliver the immunization program. How do we mitigate it? We plant about 5.7 million trees, and then we let it grow for 10 years. And then that will give us the coverage for, let's say, mitigating, how do you say, Nitant, mitigating?
Yeah, mitigating the carbon emissions that we are doing annually.
Right. Yeah, right. So carbon neutrality, that is a term I was looking at. So yeah, okay. Next slide, please. So this was the global picture, and then we deep dive into it and say that what are the various contributors. So we looked at it from 4 different part of the whole exercise. What does it take to produce different components of immunization program? So we looked at it. Production of the supplies contributes to 20% of the total emission. Transporting the vaccine cold chain to the last mile contributes to 27% of the total. Operations, which is electricity and genset use, is 25%, and waste disposal 28%, among the highest one of all of them. And when we say production, the most emissions goes towards production of syringes. Vaccine is really negligible. Producing vaccine does not really cause any emission. It's really 43 tons of CO2 compared to the global, compared to overall emissions. What we do is really negligible. And then transportation also, we see that there are different things and how differently we transport, and why the transportation is so high, because today we are transporting vaccine internationally through air shipment, and which is the biggest contributor. And a little modification here in future will give us low-hanging fruits. Also, waste disposal is very, very high, because as of now, globally, there is very little attention on how we dispose and manage our waste. So the general policy which is adopted globally is incineration of syringes, vials, and all waste, or open burn. So that brings the emission standards very, very high. Generator use, of course, grid electricity or whatever energy we need, the source of production is also very highly emitting. So that's the overall split of the emissions from these 4 sources. Nitant, next one. So we'll deep dive into each one of those. This is just a detail of it. Maybe next slide. So we look at now production emissions from production, and we take one example to explain how we calculated this so that it goes into context. So our assumption, again citing the sources we get, and it's one of the difficult thing in carbon emission space, is to get credible sources. We use the emissions of, let's say, 0.15 gram CO2 per dose of vaccine production. This is what it takes to produce single dose of vaccine. Of course, different vaccines have different production CO2 emissions. For now, we used one. And then we use WHO sizing tools for country-specific wastage rate. There are so many parameters goes into that, and I'll attempt to explain that. We take the example of Afghanistan, and we take one vaccine of BCG. BCG vaccine. Okay, so Afghanistan, the target population, total population of Afghanistan is about 40 million. And when we say target population, we are vaccinating 1.2 million children in Afghanistan every year. BCG vaccine specifically, we aim to vaccinate every child with 1 dose of BCG. Now we look at 2021 coverage information, which means we went to WHO website and WHO UNIC data, WHO UNICEF national estimates. 84% of the children were covered with BCG vaccine. This translates, and also there is also wastage rate of BCG 80%, very high. It will take a separate seminar to explain why BCG wastage rates are so high. So wastage rate is 80%. Considering this, Afghanistan would have consumed 5 million doses of BCG in 2021. Now this consumption, when we translate into the emissions, this translates into total of 76 kilograms of emission in Afghanistan of the BCG vaccine alone. And now we do this exercise for all the countries and all the vaccines. This gives us 43 ton CO2 equivalent of the vaccine contribution, which is, as you see on above, 0.01% of the total production emissions. So it's really low. And yeah, so we go to the next one, please. Nitant, next slide, please.
Yeah, I've already done. You don't see it?
No. Yeah, now it does.
Go back. Okay. Yeah. Okay.
So here we take another example of syringes, how we computed the emission for syringes. Now the syringes emission is again, we take the basic parameter that it takes 3.28 kilogram of CO2 production. CO2 is 3.2 kilo CO2 is produced for production of per kilogram of syringes. So that's how the global standards are measured. And then we do the same estimate using WHO's WHO sizing tool, PQS. We know the weight of the syringe, what it how much it weight, and how many syringes we consume. Taking the same example of BCG, we would have used 1.123 million of syringes in country. That gives us one number, that it's 22,964 tons of 64 kilograms of CO2 emissions only by using the syringe for BCG program. And then we convert that into all the vaccines, all the countries in the world, and hence we arrive at 38,401 tons of CO2 equivalent, which is 12.6% of the overall emissions. And likewise, so all the components, this was just to give an example to how to what depth we have gone in to estimate the emissions. So production wise, we saw the example of vaccine, we saw the example of syringes. Nita, next one, please.
Yeah.
There's also example of safety boxes. Now, safety boxes, as we know, it is used to store the used syringes to prevent accidental use of syringe and also prevention of infection after the syringe is used. So these safety boxes are standard. They go a part and parcel with immunization program. One safety box is supplied with every 110 syringes. Likewise, we have computed the emissions for production of safety boxes. Next one, please.
Yeah.
Yeah. So this is a cold chain one. Now this is very critical part because cold chain inventories, estimating cold chain is a bit tricky. Typically, in a country, let's say most countries, the supply chain is a 4-tier supply chain. When the vaccine arrives in a country, there is a national store which receives the vaccine, which does all the procedures of accepting the vaccine from manufacturer, and then from that point onwards, it becomes a national property of the government. And that is where the national large stores are there, and mostly cold rooms, large space cold rooms are used to store the vaccines. And then after that, there are 3 more tiers of supply chain: one regional, one district, and last is a health facility where the vaccination is done. So each country, going by the size, they have different supply chain and different number of equipment. So it's so hard to estimate anything there. We use the population figures to estimate how many cold rooms would a country need to operate the program. We use the WHO the coverage rate to say that how many vaccines is produced and is consumed in the country of each category, and then arrive at estimation of how many refrigerators would need at the 4 level of supply chain. So it's an assumption, but then, as I also said in the beginning, we created a tool where we created a placeholder for replacing with actual information. So as we go from here, we will be asking countries to provide the information on actual cold chain inventory and confirm that this is what we have. Just one more slide, please.
Yeah.
So just to explain what I just said, again, we take Afghanistan and BCG as an example. What it takes for Afghanistan to store the BCG vaccine. So Afghanistan, we know how many BCG doses are needed. It would take overall, let's say, I think, Nitant, we have used the example of all the vaccines together, not the BCG. I think it's an error.
Yeah.
For Afghanistan, it takes 137,000 liters of refrigerated vaccine storage at the national level annually. And this is the requirement at the national vaccine store. And then this would translate into, they would need 11 cold rooms at the national level. And we know that there are there are 7 subnational levels, and hence 7 cold rooms are needed at subnational level. We also estimated number of refrigerators, number of let's say, total refrigerators needed in the country, which means this we got it from estimating what is the standard use of a fridge at the health facility, which is about 10 liters, going by the applications in past, the cold chain applications in past to Gavi. We realized that it's about, when at the health facility, the smallest size of the fridge is 40 liters, but then within that 40 liters, typically about 33% is occupied and rest of the space is available. And going by that calculation, we estimated that country would need so many fridges. And then we also looked at the supply division information, that how many solar refrigerators are shipped in last 10 years. So we took that data and estimated total emissions of operating the refrigerators, or total emissions for manufacturing the refrigerators, including solar. It's a very complex exercise. I don't want to deep dive into it, but most welcome if anybody want to understand and contribute to improving it further. Most welcome. So with this, we know that what it takes to produce the cold chain equipment. Next one, please. We also did the triangulation of data just for our own. Sorry, it's the next slide, please. Yeah. So we did the triangulation of data with what was supplied, procured, and supplied by UNICEF Supply Division in last 10 years, and what we estimated. And our triangulation shows that we are approximately 96–95% to what the actual supply figures were. So we are pretty close to what we estimated. Of course, in our assumption, we have also assumed that UNICEF is not the sole is not the sole procurement agency for the cold chain. About 20% of CC is either procured directly by countries or through other support mechanism. So building that into estimation, we still are at a very good high confidence level, but still there is a scope of improvement always. Next one, please.
So basically, we understood what was involved in terms of emissions in manufacturing. And then we said that, okay, these manufactured quantities of vaccines are to be transported internationally, then how do we go about estimating? Actually, we have number of vaccine manufacturers in number of countries, and those manufacturers different vaccines, different quantities. And it is actually, in our tool, we have created placeholder for each one of these data points. However, to get that data from the vaccine manufacturers and from the countries was getting more and more difficult. So in absence of such data, how do we go about accurately estimating the emissions involved in transportation was a big challenge. And for that, we decided to rely on the worldwide available data that was studied by the World Bank. Typical shipment distances for various commodities in the world over. This data is gathered by them over a number of years, and it's getting more and more accurate year by year. So what we did was we actually went back and looked at what was the typical distance transported for pharmaceutical products, because vaccines being closest to pharmaceutical. So if you are looking at tariff international for the customs, the homogenized code chapter 30 is the pharmaceutical products. So we looked at that and we got a number for typical transportation figure for the commodity in the world over, and that comes to like 4,517 kilometers. So to best of the estimates, we decided that it is appropriate to consider that each dose of vaccine has traveled 4,517 kilometers. And now, based on the examples that Ranjit has been talking about in terms of Afghanistan and the number of vaccine doses for BCG, for example, those were transported, 5 million doses were transported. So we looked at the total volume of transportation, the weight of transportation, the weight of the vials, added everything together. And based on that, we were able to calculate how many ton kilometers of vaccine transportation was done. And then you go back and look at international data for air shipment and see how much emission is done for 1 ton kilometer of air shipment. And you see that 1 ton kilometer of air shipment is about 1.101 kilograms. And if you look at 1 ton kilometer of shipment by road, it is about 0.557 kilograms. Why road? Because the vaccine gets manufactured and there has to be some estimate about how much is road transportation done from the manufacturer to the ship port and from the port of entry to the primary store in the country. So we assume that to be 150 kilometers, and based on all that, we calculated the emission number. And here also we have to keep in mind that these vaccines are refrigerated when they're coming, so they're in cold boxes. So weight of the box, weight of the ice in the box was also calculated, and based on all that, the emissions in transportation vaccine internationally were calculated. Now, a similar exercise was done for safety boxes and syringes, and you can see that the emissions here are pretty low because safety boxes and syringes are not shipped by air. So safety boxes and syringes are typically going by sea transport. And based on all that, the international transportation emission estimates were done for these safety boxes and syringes as well. And you see that globally, the number is somewhere in the range of 1.6%. So if you go beyond this and say what happens in terms of in-country transportation, that becomes more and more difficult, because now all vaccines are going to be transported within the country from the primary store till the point health facility where the vaccine is actually going to be administered. So those distances are very, very difficult to get. So like what we in terms of the international transport distances, we also created placeholders in our tool for each vaccine, each country for the transportation, but finally decided to use a logical extrapolation of the distance. And what we did was we decided to take the area of the country and find equivalent radius of that area. And based on that, decide the average distance transported by traveled by the vaccine and safety boxes and syringes in the country. So based on that, what we estimate is within country, the transportation of vaccine was about 3% altogether globally. So some close to 11,000 tons of carbon dioxide emissions. And if you look at similar case in terms of the ancillary supplies, it turns out to be about 2.43. Now, both these numbers are comparable because their weights are comparable and distances are comparable, and both are being transported by same mode, that is, they are going by road. And that is why you have similar estimates for these entities. So around 8,500 tons of CO2 emissions is what one would see globally for transporting the ancillary for the vaccination program. This is as far as transportation is concerned, but now operation is also an extremely important part. As Ranjit mentioned that for every country, electricity scenario, for every country, the emissions by electricity is different. So we had to rely on data and figure out how much the emissions are going to be. So now that we have to look at operational expenses, we know the number of refrigerators we have, we know the consumption of the refrigerators on an average, what kilowatt hours it will consume per day. And based on all that, we looked at how many kilowatt hours will be consumed by the cold chain every day and for every year. However, this electricity is going to come from grid in the country, as well as in absence of grid from genset that is operated. So for every country, we got numbers from the World Bank data as to how good or how bad was the grid. And on an average, energy was to be produced by local generator, so diesel generator. And then we took that number, and also for every country, the electricity is getting produced by different means. So either by thermal electric generation, or by nuclear, or by hydropower. And based on that, the emissions involved in generating electricity are also different. So we got those numbers from the World Bank data, and based on the consumption and based on the availability of grid, we worked out the numbers for the total operating energy and operating emissions for the cold chain for the vaccination program. And it turns out to be around 85,800, so 86,000 tons of carbon dioxide equivalent annually being emitted for the entire cold chain in the world over. So another important aspect is, as Ranjit mentioned, waste disposal. We have large quantities of syringes and safety boxes which are getting burnt. And based on the emission factors for burning plastic and burning cardboard, and the weights of the syringes and the weights of the safety boxes, we worked out the number. In case of Afghanistan, it was worked for BCG. Just to give a case study for you, for Afghanistan, we will have about 22,750 kilograms of emissions of carbon dioxide. But world over, if you look at the entire emissions for getting rid of the immunization waste, specifically syringes and safety boxes, it is around 98,400 tons of carbon dioxide emissions. So this is a very large contributor. About 28% of the total emissions are seen in the burning in case of waste disposal. So similarly, we have to also look at what happens at the end of life of the cold chain equipment. So we typically assume that about 10 years is the life cold chain equipment. That's what on an average a refrigerator works for. And then for the temperature monitoring devices, 5 years of life was considered. And based on that, based on their weight, and based on the estimates of emission factors given by reputed data sources in the world over, we were able to estimate the decommissioning emissions. But if you look at the number, it's like 0.04% of the total emissions. So it is absolutely negligible, but still we have placeholders and we have calculated that. And based on that, we can say the contribution is very negligible. So one more important aspect that we need to look at is what happens when we use the solar direct drive refrigerators. And in the world over, we have around 80,000 plus SDDs installed. And if you look at the total emissions that we have done and total emissions that the SDD has saved, it turns out to be around 16,000, 17,000 tons of carbon dioxide emissions annually being saved by deploying solar direct drive refrigerators. So it is a little over 14% of the total emissions that we have estimated. So here we come to the end of the exercise, and we take you to the conclusions and recommendations. Michelle, I'll hand it over to you.
Great, thank you very much, Nitant and Ranjit. So next slide, please. And I think we'll see here that when you compare the immunization program to global emissions, and you think of mining or energy generation, etc., the footprint is quite small. However, it is still something we do think about as well. So, and in summary, we've seen that the burning of waste or the incineration of waste is the largest contributor to the emissions, and following that is obviously the operations of cold chain equipment, which is nearly a quarter of that. And then international air shipments is also a significant contributor. And then we also see the production of syringes and safety boxes contributing significantly as well. And then, as Nitant explained, bringing in those solar direct drive refrigerators does reduce emissions, but we also need to think about those solar panels and how we recycle everything as well in the future. And then, we have used a lot of estimates and assumptions as well, but as there's more granular data available, this will improve the accuracy of further iterations and estimations. Next slide, please. So some high-level recommendations that we've come to when we have a look at this entire analysis is that in our operations, if we could solarize or use sustainable energy sources, this could reduce emissions by 25%. Transportation, as we said, was a significant contributor as well. So switching from shipping by sea from air would also significantly help. And then also looking at circular supply chains, upcycling of plastics, and looking at the whole product life cycle will also reduce total emissions as well. Next slide. So we've had a look in terms of what we're going to do with this information next. Obviously, implementing a lot of those recommendations. Within supply division, they have many steps that they're taking as well in terms of reducing emissions too. Because a lot of work takes place in terms of getting supplies to countries as well. So there is an active move towards reducing emissions there too. But what we want to do is make sure that we have a carbon emissions profile for each country, and that where countries can also update the information that based on the assumptions that we've made and correct some of those as well. And then also start looking at defining the strategic and programmatic interventions and looking at a program for themselves as well. And then look at those targets for reducing their carbon emissions, and then start tracking those as well. So, but all in all, we will be disseminating this, and this will be available on the TechNet website, and we will be translating this PowerPoint as well in its full form too, and there will be reports available. I think that comes to the end of the presentation, and I think what we will do is we will open up for some questions and answers.
Okay, so I will stop sharing the screen now.
Thanks, Nitant. So I can't see any hands, but I see there are still some questions in the chat. So maybe I can flag those for you. And there's one by Ute. 2021 was the year of the most COVID-19 vaccines. Were these vaccination procedures included in the study? And if yes, is there a comparison to a year without the pandemic? Ranjit, do you want to take that?
Yes, Michelle. So COVID-19 vaccines will be included in our release 2.0 by end of this year, where we have a more expanded vaccines included into that. For now, this was only the routine immunization.
Thanks. And Anthony Battersby was asking, have you taken into account the CO2 from the administration of the vaccine? And Nitant, do you want to answer that?
from administration of the vaccine. Actually, what we have done is the emissions in the implementation of the program in terms of manufacturing, transportation, and administration all the way to the child. The transportation of that is included. The cooling of vaccine is included. But if you are looking at overheads in terms of the travel of the people, the offices, and all that stuff is not included. So vaccine-related emissions are included, but overheads-related emissions are not included in the present scenario because it's very difficult to get data on that.
Super, thanks. And Saira Patel is asking, is there any work plan to examine how many emissions are saved by vaccination through the prevention of VPDs and consequent healthcare utilization? Ranjit?
An excellent one. No, not yet, but yes, this is something we are looking at, the emissions, saving in emissions, as our next exercise, where we'll be opening up to countries and say, look, what have been achieved so far, and henceforth what emissions have we reduced. So not for this exercise. This exercise is purely on what are our emissions, but then yes, by next year we will have what are the savings by countries.
And Analia Khan had a comment. I've noticed the consideration of thermostable vaccines can be delivered in a controlled temperature chain has not been mentioned. CTC allows last mile delivery without the cold chain, which could have been an important impact on the carbon footprint. Surely encouraging manufacturers to develop more thermostable or CTC qualified vaccines is an important next step, as is advocating that countries adopt this approach when available. Ranjit, do you have any comments on that?
So, well, CTCs are there for remotest part of the places where there is no cold chain. I mean, where we can sustain the vaccine for 30 days in a box, and that is also used as a or let's say no. These are the 30 degrees or below where hepatitis B is being tested, if I get it right. For routine vaccine, all we have done is we have included the cold boxes, vaccine carriers, and all sort of devices that are used. But for CTC, it's still, how many vaccines are we using CTC today? I don't think much. It's only hepatitis B which was being considered, to my knowledge.
So I think it is a useful recommendation, Annelie, and I think it is something that we should include. Thank you. I don't see any further hands or Gigi, I don't know if you can see anything, but then so I think it's over to you.
Yeah, no, I haven't seen any question in the chat either.
Oh,
so
Emmanuel has a hand.
okay, please go ahead.
Can you hear me?
Yes.
Yes. Yeah, thank you. That was an exciting presentation. I'm just being curious from the data that was presented. From where I'm sitting as also a practitioner, supply chain practitioner in the immunization space, I can see a lot of investment in the area of manufacturing, in the area of shipment, in the area of storage, where we look at the best practice innovation in terms of even choosing coaching equipment that are environmental friendly. I have not seen much in the area of waste disposal. And I think the data also speak to the fact that we have much of issues around waste disposal as it's impacting on the environment. What might be the problem? Is it that partners are not interested in the waste disposal space? For that matter, we are not seeing much of investment in dealing with the issues that we find ourselves. Over.
Ranjit, do you want to take that one? You're the that's your focal area.
I could partially hear it. I missed half the question for some reason.
So he was asking about the fact that waste management there's a lack of investment and prioritization in waste management, and why is that? What are the gaps? Why? How do we get governments to invest and prioritize waste management?
Thanks so much. Excellent question. I think the first step is to identify what our gaps are, is to plan it well, to say what our needs are on waste management. Traditionally, it has been a forgotten area where we don't budget for waste management, very little budget, and then very little allocation. So we need to plan well to say that what technologies we want to go ahead for managing the waste. Are we investing in greener technologies? Are we going with incineration? And then make a national plan out of it. I think that's the first step. And that national plan has to be then put forward with ministries for funding, with donors for funding, and then take it from there. We also need to demonstrate in small scale in each country to say what our success rate is and what our learnings are before scaling up such solutions. So we are moving ahead with greener technologies now, which are less polluting. These are we are doing LTAs. UNICEF is doing LTAs and also promoting with many countries to go into direction of planning the waste management initiatives. So planning is the first step. I think before asking for solutions, we must know that what are we asking for and what else. We need to look at 10 years of horizon and say what is our short-term needs, medium-term needs, and long-term needs.
Yeah, and I think to add to that as well, I mean, it's a system that needs to be planned for too, and I think that's where a lot of the challenge lies as well. It's not just putting an incinerator in place or some piece of technology, but there's a whole human resources element and change management process and logistics behind that as well. I think there are a couple more questions that have just come in. Syra is asking about whether we would do the exercise for the emissions for non-childhood vaccines, for adult vaccines for seasonal influenza as well. So Ranjit, would you like to answer that, please?
Sure. We do definitely. I mean that's on that, and also COVID is part of that exercise. It's pandemic response. So whatever vaccines programs we have, yellow fever, or let us say there's also adult vaccination, yellow fever specifically. We do have it. Include that in our next plan.
And Anthony Battersby is asking, what has happened to syringe melting and plastic upcycling as an alternative to incineration, which I think we referenced in the recommendation. Yes. But Ranjit, go ahead.
That's right, precisely. That's one of the recommendations that we should be looking at recycling and converting the plastic waste into something usable.
Okay, all right. Super. I think the rest are mostly recommendations. I can also see, right, and Maricel is asking about the mapping of countries in terms of government, of which government agencies in charge of waste management. Ranjit, do you
see the question? I can't see the question.
It's in the chat. It's not in the
Q&A. All right. Which government agency is in charge for is difficult. It's but what we are for our entry point right now is the Ministry of Health, because we are looking at the primary healthcare waste. It's normally it's difficult for different countries. They have different contexts. It's between Ministry of Environment and Health mostly.
Okay, and there are no more hands. All right, Gigi, over to you.
Okay, thank you very much to all of you, our panelists, Michelle, Ranjit, and Nitant for your presentation and for taking the time to reply to our participants' questions. I would like to remind all the participants that you will receive the link to the recording and the presentation by email in the coming days. And if you don't have any last word, I'm going to close this session here. Again, thank you to our panelists and thank you to all our attendees for your participation, your questions, your engagement. And we'll look forward to having you on another webinar. Goodbye.
Thank you. Bye-bye.
Thanks. Bye.